Hi there, I'm Melanie. I'm the training manager with Inspired Cosmetic Training and was speaking at the Scottish Aesthetic Conference 2024, and quite a few delegates had asked for a copy of the breakout session of how to get started in facial aesthetics. So here we are. So how to kickstart your medical aesthetic career and learn what you need to do to avoid making mistakes, gain some top tips and advice from medical aesthetic practitioners about how they started up and have gone on to great success. I'm Melanie. I qualified as a dentist in 2007, and from 2009 until the end of 2020, I ran my own practice. Very proud to have won the Scottish Dental Practice of the Year award for our commitment to care for our patients. For 4 years, while running the practice, I taught and trained newly qualified dentists in the vocational training year. I really enjoyed the teaching aspect of this. I always had an interest in adding facial aesthetics to my practice, and 5 years ago, after doing some research, I chose a foundation course and learned Botox and filler. Since then, I've continued to enhance and improve my skills and become an enhanced aesthetic practitioner. Sorry, Lara, we're going to start that from the beginning. Okay. Hi, I'm Melanie. I'm the Inspired Cosmetic Training. Lara, start it again. Sorry. 3, 2, 1. Hi, I'm Melanie. I'm the training manager for Inspired Cosmetic Training. We had the Scottish Aesthetic Conference 2024 at the weekend, and quite a few delegates asked if they could have a copy of the slides from my breakout session on how to get started with facial aesthetics in 2024. So I'm Melanie. I qualified as a dentist in 2007, and from 2009 until the end of 2020, I ran my own practice. I'm very proud that we won the Scottish Dental Practice of the Year award for our commitment to patient care, and this really made up the ethos of our practice. For 4 years while running the practice, I taught and trained newly qualified dentists in their vocational training year. I really enjoyed the teaching aspect of this. I'd always had an interest in facial aesthetics and adding this to my practice. So 5 years ago, after doing a bit of research, I completed my first aesthetics course in foundation, Botox and filler. Since then, I've continued to advance and improve my skills, and I've become an enhanced aesthetics practitioner. I've found that it goes hand in hand with dentistry in the way we can treat the overall face and not just the teeth in isolation. My background in mentoring new graduates is also ideal for the role that I have with Inspired Cosmetic Training as their training manager, where I work behind the scenes with the team who organised the conference today, as well as delivering hands-on clinical sessions to our delegates and mentoring nurses who are looking to complete their V300 prescribing course. In my spare time, I'm a busy mum, wife, and enjoy family walks with my husband, son, and dog, as well as planning holidays, and this year started a postgraduate diploma. So why should you work in facial aesthetics? Well, it's a fantastic area to work in. It's so rewarding to see how appropriate treatments that we can carry out can increase a patient's confidence and make them feel happier about themselves. The industry is booming. There are new techniques and advances all the time. There's a talk today on polynucleotides, which is the next big thing. So make sure you try and see that and get some information. Your working hours can be flexible. You can work part-time and do aesthetics around this while you're building your aesthetic business. You can choose hours that are going to work best for you. There's great earning potential from facial aesthetics, and it can be a great add-on to the services that you already provide. So where do I start? You're looking for a course, and whatever stage you're at, you need to make sure that the course that you're choosing is appropriate for you and suits your needs. As a registered medical professional, you want to ensure that the training is being given to you by other medical professionals, that they're going to give you adequate pre- and post-training support, and that during the hands-on day, you get a chance to properly treat a patient. And there's so many courses have you sharing a face when doing the hands-on day, and this isn't really ideal. You want to be able to treat the areas that you're learning about as a whole, to know how to create symmetry, and often this isn't possible when treating half a face. From personal experience, on one occasion I have chosen poorly, and ultimately the course was a waste of time and money, and I had to pay again with a different provider to ensure I had a good understanding of the treatments I was providing, and to make sure I was safe and competent. There was little pre-course reading to do, no follow-up, no post-training support at all, and it was an expensive lesson to learn early on in my career. But I'd like to think that I wouldn't get caught out in that respect again, and hopefully that won't happen to any of you either. But if it has happened and you feel like you need some refresher training or some mentoring to ensure you're safe and confident, then this is something we can help you with. When you start your training with us at Inspired Cosmetic Training, your foundation course will cover the upper third of the face to treat with Botox, which includes how to treat the frown, the crow's feet, and the forehead lines, as well as learning how to add definition and volume to the lips. So, what's next? You've done your training, but what do you have to do? First things first, make sure you have appropriate insurance or indemnity cover in place and that you understand the difference between them. Hamilton Fraser are a company that I've used before and I can recommend them. The best piece of advice I was given when doing a course was to make sure I have suitable clients lined up for the week after the course so that you can dive right into carrying out the treatments that you've just learned. It will be fresh in your mind and you're motivated from the course. So it's a good idea to be able to start your new skills as soon as you can. The longer you wait, the more you forget, you start to doubt what you're doing. So try and have some clients in place ready to go after your course once you've added it to your insurance. I love this quote by Walt Disney. The way to get started is to quit talking and begin doing. So after hearing this piece of advice, this really resonated with me. If it makes you feel more comfortable, have a little cheat sheet laminated and up on your clinic wall. For example, with dilutions of units of toxin for your different areas, and it's just giving you a quick reference point to help while you're starting up. Where can you work? As a registered healthcare professional, you must work from a Health Improvement Scotland registered premises or a dental practice that's had its combined practice inspection. If you're opening your own place, you must have his registration before you can carry out aesthetic treatments. This can take some time, approximately 3 months from submitting your application and your payment for an inspection to be carried out on your premises and your registration approved. So what do you do in the meantime? Or what do you do if you don't want to have your own premises? Well, you can get practicing privileges from a clinic that already has a HIS registration. For example, the Glen Clinic has rooms available to hire at an early rate. There's a special rate for delegates that have had training with Inspired. You'll need proof of your qualification, your course certificates, insurance, ID checks, and PVG for practicing privileges in any HIS clinic that you want to work at. If you're not a prescriber, what does that mean for you? Well, if you're not a nurse prescriber, it doesn't mean you can't work. It just means that to carry out treatments that are done using prescription-only medication, POM, you need to have a prescriber on site to carry out face-to-face consultations with you and your patient before a prescription can be issued. You and your prescriber risk your registration if you don't see clients face-to-face before this script being done, and it has to be done at a regulated, registered premises. Filler treatments themselves, they're not POMs, but the reversal agent for filler is, and has recently introduced a new regulation that anyone who's not a prescriber and is carrying out filler treatments must have their prescriber on site or within a reasonable contactable distance should you need Hyleas to be prescribed in an emergency for your patient to dissolve the filler. You can also look into completing your V300 course, and Alison Wood from the Queen Margaret University has been here today and can provide you with more information on this if it's something that you're considering. How do I get clients? You're starting out, you don't know where to get your clients from, and in this day and age, social media is a big driving force for many businesses. So take some time to set up your brand. Identify your USP, your unique selling point. What is it that sets you apart from other injectors? What do you bring to the table that lets clients know they should come to you over the person down the road? Once you've found your USP, build on it, form your ethos, and turn these points into you and your brand. A lot of delegates or people who come to our open day events will ask, how do I compete with the nail tech down the road? The short answer to that is you don't. They don't have your experience, they don't have your medical skill set and background in patient care. So don't compete with them, set yourselves apart from them. Your clients will see your value and expertise, and if they don't, you don't want them as clients. You'll always get somebody who's shopping around for the next best deal, so don't be disheartened if those people leave. They're not the clients that you want to be treating either. When you're starting out, it's a good idea to have an open day or an open evening to showcase and explain what new treatments you can provide. Bear in mind that not everyone who comes to see you will want other people to know that they're considering having facial aesthetics, so it's a good idea to combine your open day with something else. If you're a dentist, you could combine it with an Invisalign open day. If you're a nurse or a doctor, you could combine it with the launch of a new skincare or facial treatment that you're going to offer. This will broaden your target audience. It may even mean that people who are only considering some skincare then see what you can offer at the open day event and come to you for consultations about injectables too. You can advertise in free directories and local magazines. You can think about collaborating with other local small businesses and have each other's flyers and leaflets available. You can also use the Business Gateway, who help businesses all over Scotland with support and free business training. Building a portfolio of befores and afters is also something that you want to look at doing. But you've just started, so you don't really have any pictures to show prospective clients what you can achieve for them. So to build this, you could consider treating your friends and family for cost, with the understanding that you can use their pictures to showcase your skills. You can offer treatments at a slightly reduced rate to clients that you want to use as models, and again, with the understanding that you use their photographs to show your work. While we're talking about pictures and advertising, let's touch on what you can and can't do with regards to this. We've all seen on Facebook and Instagram posts talking about Botox along with before and afters and special offers, but as registered professionals, it's against the Advertising Standards Association to advertise anything that is a prescription-only medication. Botox is a prescription-only medication, and as such, you can't advertise it. You can post pictures of before and afters with the tag or headline of anti-wrinkle treatments, so you can advertise your facial rejuvenation clinic, but you can't specifically say Botox and anti-wrinkle injections. With pictures, you must ensure you have a robust consent form for photographs to be taken and for them to be shared with other clients on digital platforms and in any advertising you may do. If you don't feel you have a good consent form for this, please get in touch with us, and this is something we can help you with. Pictures should also not be taken on your personal phone or iPad. If you're using a phone, iPad, or digital camera to take pictures, this should really be a work-specific item and stored safely under lock and key, as well as being password protected. If you were to lose your device, then you've breached GDPR and data protection by having patients' clinical pictures on it. If you are using your own phone or camera, then it's a good idea to have an SD card that you use solely for clinical photographs, and it's removed from the device when you're not in clinic and stored securely, like in a locked filing cabinet or safe. Always take before and after pictures. It's so important. It's easy at the beginning to get flustered and forget a step, or if you've seen the client so many times over the years, you're so busy catching up, you forget to take pictures. But it's not only important for viewing before and after treatment, but it's your backup, and it's essential for your insurance purposes that you have them. Say, for example, a patient has one side of the lip that's bigger than the other side pre-treatment, but this is something they've never noticed. It's something you don't point out to them, and it's something that can't be corrected during treatment. Well, what happens? The patient goes home and they suddenly start really looking at their face and lips, and then they notice that asymmetry. Now, it's always been there. It's not something you created, but the patient hasn't been aware of it. They're going to contact you and tell them you've made their lips uneven. Now, imagine you don't have any before pictures. You know it was there. You've written it in your notes. But did you point it out to the patient? Did they understand what you were pointing out? You've no proof that it was there prior to treatment if you didn't take pictures. So these pictures are essential as your backup. And if there are any irregularities or asymmetries prior to treatment, show the patient in the pictures so they see what you see. Point this out before you do a treatment, and the patient won't come back saying that it's something that you caused. Consultation is key. Having a robust consultation process that you follow every time will save you from many pitfalls. Take the time at the consultation appointment to really get to know and understand your client's concerns. Don't go pointing out flaws as you see them. Ask the patient what's brought them to you. What is it they don't like? What do they feel they'd like to achieve? And also ask them what they do like about themselves or their face. It's at this appointment that you'll check their suitability for treatment. Now, this isn't just are they medically fit and well enough for treatment? It's is this treatment appropriate for them? Do they see a flaw that isn't really there? Do they have signs of body dysmorphia? When did they last have treatment if it wasn't from you? What did they not like about the outcome of the treatment? For example, they had a heavy brow from toxin. You want to avoid this, so it's important to ask questions like this during the consultation to formulate an appropriate course of treatment for each individual. Sometimes clients will come in asking for toxin, but what they really need or want is filler. They just don't know what goes where. The choice of product will be determined at the consultation appointment too, so it's important to understand what the patient's goals are. Do they want a subtle definition to their lips? Are you going to use RHA2 or Kiss here? Do they want a fuller, plumper smile? In which case I'd go for something adding more volume like RHA3. It's important to remember it's not a one-size-fits-all approach, especially when it comes to filler, and you need to choose the product that's most appropriate to your patient. What else can you add to your treatment list? Well, apart from toxin and filler, there are a number of other treatments that you might want to consider adding, such as injectable skin boosters to help the integrity of the skin, microneedling, whether this be with a medical grade device or a manual device, facials and peels, and offering a skincare range to your clients. The better the integrity of their skin, the better any of your aesthetic treatment results will be. Teoxane and Zedo do a lovely range of medical grade skincare products, and they can be combined with medical in-office peels. And these treatments can be excellent add-ons to your aesthetic practice and really help increase your profitability. So a little bit about Inspired Cosmetic training. Since 2009, we've trained over 3,000 dentists, doctors and nurses, and our team would love to help you start your dream career too. As well as myself, we have a great team of very experienced trainers, including Dr. Patrick Treacy, who's a pioneer in aesthetic medicine. He won the top Global Aesthetic Doctor 2019. Dr. Heather Muir, who's a dentist and one of the UK's leading experts in non-surgical facial aesthetics and a key opinion leader for Teoxane, and Dr. Ahmed El Husseini, who is a key opinion leader for Linden Laser and Allergan. He's got over 15 years experience in medical and aesthetic practice. Inspired Cosmetic training offer 24/7 ongoing support, webinars and delegate get-togethers, as well as study clubs, which are coming soon. We've a closed Facebook forum for delegates to ask questions and to have discussions freely on. We can provide you with free business and marketing advice, access to delegate resources, and we have prescribing lists that cover all of Scotland and V300 placements. There's also a special offer on for anybody who wants to sign up to foundation courses, quote SAC24 when registering for the course. Hope this has been helpful, and any questions, please just send us an email. Okay.